everybody. Thank you so much for joining today's microlesson. My name is Brieanne Kinghorn. I'm really excited to be hosting today's webinar about coding and the implications in healthcare in Canada. And I'm also going to be talking about the wonderful program of Diploma of Health Information Management here at Ashton College. So I will start with a bit of an introduction about myself and my career, and then I'm going to get into the topic. I'll wrap it up with the information about the program and all the careers you can look forward to. And I'm excited to get sharing my passion on it. So I'm a data quality and clinical documentation integrity specialist in Alberta. That's a very long title, but I'll explain it in a minute. And I'm also an instructor here at the Ashton College Diploma of Health Information Management. We also call this the CHIM program because CHIM is the acronym that we use. So I might say that along the way. So I started out my kind of career in a Bachelor of Science at the University of Victoria. I specialized in biology, and I focused mostly on microbiology and genetics. There I was really fortunate enough to have some time to explore really interesting electives, including biomedical ethics, where I was introduced to the topic of health information privacy and data management. I eventually finished that degree, but wasn't really that impressed by the career options that were available to me. A lot of the career options required higher education and a lot more time and money to qualify for. So ultimately, I was interested in a more career-oriented program. I sort of looked around, shopped around programs, and I applied to the Southern Alberta Institute of Technology in my home city of Calgary, where I applied to a couple programs, including sonography and respiratory therapy. But I realized that I didn't really love the healthcare side of things that was involved of patient care. So I really wanted something that was healthcare, but not really kind of direct patient care. And that led me to the Diploma of Health Information Management. It drew me in that the program was not, or the career was not in direct patient care, but it also drew me in that there's really seemingly obvious, endless career options for us. It's a pretty diverse field, and it's actually pretty hard to describe when you're trying to sort of define it for people who don't know the type of work we do. So today I'm going to try my best to highlight some of the most interesting career prospects, and I'm going to share some passion about the work that I do and that I find interesting in my micro lesson today. So after I finished graduating from the diploma program, I was actually lucky enough to receive multiple job offers, and I chose from lots of different types of roles, all of which were in my home province. Which was a huge eye-opener for me. I think that it's really amazing that this field really opens up for you as long as you put in some time and effort to integrate into the community. What I love especially is that you can do that as a student. There are countless events and opportunities to network, really passionate individuals who really want to talk about their work, and you really can do that as a student. You can get involved so much right from the beginning. I started my career in health information management as a clinical coding specialist, where I spent a lot of my time learning where I see the future, where I want to go within the discipline, and I made really great efforts to connect with like-minded individuals and learn as much as possible about their careers. Eventually, that led me to my work in data quality and clinical documentation integrity, which is a very long-winded way of describing auditing and training and data quality projects that I do for our data collection team. So in Alberta, our data collection team is a group of HIM professionals, about 300 of us, who translate clinical documentation into combinations of codes that can be used to analyze our care system on a very large scale. This practice is referred to as clinical coding. It's not only a Canadian data practice, but it's also a global data language. And that's really useful for, as I said, analyzing data because we use the International Classification of Disease and that it was developed by the World Health Organization. It makes the health data that we use really comparable and also easy to extract. So that's going to be my topic today. I want to talk to you about how we capture health data, why it's really important, and what the future might lead to. I'm excited to share some passion for this industry and the specific work I do, and hopefully I'll kind of convince some of you to get into the field. Let's start out with how we capture health data. So as I said, we refer to this practice as clinical coding. It can also be referred to as data classification. Sometimes our classes will be called data classification. But in the kind of workforce, we call those clinical coding specialists or clinical coders. So while the word coding might suggest that there's a bit of a scary aspect with blocks of text on black screens, or hacking into a mainframe, or some sort of reference about computer coding, I promise you what we do is significantly easier to learn and a lot less intimidating than the computer coding that we sort of think of. Clinical coding is basically the translation of massive charts and clinical documentation from any given hospital encounter into specific, understandable, and concise alphanumeric codes. And those describe the patient's diagnoses and treatment that they underwent. We have two major types of coding. We have acute coding, which is inpatient, and we also have ambulatory coding, which is outpatient. Inpatient coding can be considered more difficult because it deals with patients who are admitted to the hospital. They're usually undergoing very intensive medical treatments. And then on the other hand, we have outpatient coding. It's a bit simpler since it only deals with patients who are attending the emergency department or day surgery clinics, where the encounter usually lasts only a few days. Basically, regardless of where a patient is admitted, if they're admitted to the hospital for weeks on end, or if they're just seen in the urgent care for a case of the sniffles, we capture that encounter and translate that chart into codes. Eventually, those codes live within massive databases, and that's ready for analysis. I'm going to give you guys a crash course into clinical coding, and I'm going to try my best to give you an overview of what coding actually looks like, and then I'll get into all why it's important and what we do with it. Diagnostic codes are comprised of a letter that reflects a category of disease. So for instance, we have cardiovascular or respiratory or obstetrics. All of these are disciplines within the healthcare. And then we have 2 to 6 characters that follow that letter, which completes the code into a coherent and relative description of disease. Now I say relative because I mean that the digits really do have meaning relative to each other. So when digits are closer together, when these codes are closer together, the diseases are more closely related to each other. Codes that have the same first 3 characters are often classified similarly in terms of like their resource intensity, so how much we pay for those diseases in the hospital, and they can even sometimes be considered a singular disease when we're researching. So for example, we have a code like I-10-0, and that describes a cardiovascular disease because the I chapter is for cardiovascular. And then the 10 describes a hypertensive disorder, which means high blood pressure. And then finally, that point 0 describes it being benign or primary, which is a hypertensive disorder. And this I-10-0 code is one of the more common codes that we capture because high blood pressure is the kind of colloquial name for it, is so common in Canada for people who are chronically ill with cardiovascular disease. And this code here has relative other versions of hypertensive disorders that can all be related to each other and then they can be analyzed. Intervention codes, on the other hand, are a bit longer. They can be slightly more complex as well. And these ones are Canadian-specific codes. So they're comprised of many more characters. These can reflect the type of therapy, location of intervention, the extent of the surgery or procedure, and even the method that the team undertook. So for simple surgeries, we can have just a few characters. The minimum is 7 characters. But for really complex surgeries that have grafting or specialized instruments, we could have up to 10 characters. So these are long codes that we can input, and they are very descriptive. So for example, a really common one is a chest x-ray, and that would be captured as a 3 GY10VA, where the 3 describes the intervention being diagnostic imaging, the GY describes the location being that it is the thoracic cavity or the chest, the 10 describes the fact that it is x-ray, not just any image, and the VA describes the fact that it is just a regular image without enhancement. So that's the beauty of coding. We can have multiple really complex scenarios with one code to describe it all. We can also have scenarios where there's really complicated surgeries that require more than one code to reflect all the complexities, but in any case, we can capture that detail really articulately. While it might sound a bit like data entry, it is far more complex because there's a lot more interpretation of clinical documentation. We have the application of unique rules and guidelines and the understanding of data as itself, kind of as it lives in the databases. One of the best parts about clinical coding is that it is constantly evolving to incorporate current diseases, surgeries, and new treatments. So we work really hard to be able to keep up with what changes our healthcare system faces in real time without the delay of information. I really want to get into an example of this because the development and deployment of provisional codes for the COVID-19 pandemic was so amazing, and we were able to capture so much more data than we could have. Well, at the time, we had really articulate and accurate information about positive results. We got mandatory reporting from labs. There's a lot of information that was missed in that simple positive versus negative. We would have missed the complications that a patient may have had. We would have missed scenarios where a patient contracted that infection within the hospital. And we would have missed all that data, but because we had clinical coding and then the subsequent data analysis of encoded data, we were able to have that holistic view of the care provided for COVID-19 patients. We can see all their associated data. We can see the encounter as kind of a whole, but very articulately and comparable to each other. So I think it's a fantastic example of why clinical coding is far more than just capturing of data. It's a presentation of information. We use it to provide more detail than we can just see in the numbers that live in that database. Clinical coding is more than just the code that we actually choose. We also have the ability to include other data elements, so we can add more information about specific diseases or the circumstances for the patient. We can capture when an illness was contracted in a hospital setting. We can capture when a disease was contributing to a specific encounter but not necessarily treated. We can even capture the decisions that were made that resulted in the treatment that a patient had. For example, when we capture when a patient undergoes a C-section or the delivery of a baby via surgery, if that C-section was their first, we can capture that information. We can capture that it was planned prior to admission, or even if it was done purely based on maternal choice, where they don't want to have a natural vaginal birth, that they want to have a C-section. Another example is when a patient with diabetes is treated for a complication of that disease, but they're never treated for diabetes within their encounter. For example, when they're admitted for amputation of a diabetic foot infection, we can capture the fact that the infection was really the contributor, but that we can capture diabetes as a significant comorbidity of the disease. So it actually caused the disease and therefore the amputation. All of this is linked together and that creates a really clear understanding of that visit. The combination of codes that is captured and then all of the associated data elements provides a really clear picture about what care was provided. So instead of pages and pages of clinical documentation, the entire encounter can be condensed down into a handful of data elements and just a few characters, and we don't lose any data at all. So I want to highlight, because it's always a little bit of fun, I want to highlight some of my favorite codes that captured this detail really perfectly. And these are real codes. So we have, for example, codes that capture injuries that were caused by snowmobile accidents or injuries caused when a person was carrying a kite. So if they were flying a kite and they injured themselves, we have that detail in a database somewhere. We can also code something called worried well, which is an encounter where a patient suspects that they have a problem, but they never have any evidence of disease. So for instance, a parent might be concerned that their child swallowed a toy, but there's no toy on the x-rays and the child has no abdominal pain, and they find the toy in the pocket or something like that. There are also codes to capture unfortunate medical errors. We call them misadventures. Things like accidental cuts or surgical instruments being left in patients. They're never a desirable outcome, but we also think it's really important to capture that data because then we can actually have information about what occurred, how it occurred, and when it occurred. Moreover, we can capture codes that encompass side effects of medication or post-operative infections, and all of these codes are collected to accurately and effectively represent an encounter very, very succinctly. So in other words, the purpose of coded data is to create data that can be stored and categorized and then easily retrieved. This makes health data very usable for any number of health agencies, and health data can then be de-identified, which then allows us to use it in a broader application. So when When data is individual, we can't necessarily use it on all the same ways. It has to go through a lot of privacy. But when we have it coded and therefore de-identified, we can use that information to research without any of the privacy concerns. So there are a few obvious ways that health data is used. I've talked about a few already, but there are so many more ways that we can use encoded health data to effectively deliver healthcare to Canadians. Some examples of this include incidences of disease, so we can count how often a disease happens. We use it for resource allocation, quality and safety of care, research to advance medical knowledge. We also use it for health policy decisions, and we use that on levels provincial, local, and federal. And we can even use it to fund our healthcare facilities. So it depends on what province you're in, but some fund based on coded data, and others do it other ways. But one of the most common, especially in the United States, is funding based on coding. We're able to use the data that is available within a health record, but we maintain the privacy and security of those records. So we can use it to bill, we can use it to advance medical knowledge. All the time, we're just maintaining the privacy of the record, and we're not actually looking at anybody's charts. So now I want to talk about what the future holds for health data in Canada. So as we know, and I'm sure some of us despise it even, there's an influx of new and advanced technologies that are taking over the simple data management practices that we currently build and maintain. But that isn't the end of clinical coding. We do have computer-assisted coding where we use AI to help us add detail or help us code. But most coders that you talk to will tell you that the most difficult part of coding is the reading and interpretation of clinical documentation. We're faced with really complicated medical jargon, abbreviations, and case studies that don't necessarily fit within a coding box. And that's why our job as HIM professionals is not in jeopardy with the rise of artificial intelligence and the technology involved in healthcare. It's true that change is coming, but honestly, the truth is that technology is nowhere near as effective and articulate as a human coder who is genuinely reading a chart and applying their expertise and appropriately coding a chart. That's where you guys come in as new HIM professionals. And that's why I want to spend a few minutes on a sales pitch for careers in health information management. One of my favorite parts about this career is that the skills are really transferable, not just to healthcare, but to many other industries. For most HIM graduates, the common roles are in healthcare settings like hospitals or health agencies, primary care clinics, doctor's offices, things like that. But there's lots of opportunity to bring your skills to other settings. Data management and privacy, basic medical understanding, all of this can be applied to careers in private health, insurance and medical billing, private companies with data management needs, specifically those that have health data or similarly large data sets. And not all those careers require a credential in health information management, but the skills that you gain in a program like this one are really absolutely essential for any professional looking for new and exciting work. One of the biggest challenges for HIM new graduates is trying to navigate the field and figure out what career might suit them best. For this, my advice would be the same for any new graduate. Find people within your field and ask them about their jobs. I think that there's a lot of value in asking about people about what they're passionate about and what they think got them to where they are. And I also think there's lots of value in connecting personally. Most HIM professionals that I know are very passionate people who love to talk about their work. Most can probably even spend 20 minutes jabbering on like I've done today. So really do reach out via LinkedIn, attend events like this one, and don't be afraid to put yourself out there. I would not be where I am today without taking major risks, without putting myself into situations where I can genuinely interact with my peers and mentors. Although your career is based on your professional life, there's always an aspect of personal authenticity that you can bring to your career which makes you a unique candidate. So really make personal connections with those in the industry. A program like the Diploma of Health Information Management at Ashton College allows students to have access to interesting HIM professionals, and it makes learning more than just about the material being taught. It makes learning about the genuine relationships that you can build between yourselves and also your instructors. As far as what a career might look like, you can be involved in health data in a lot of ways. You can be involved in the inception of health data as a clinical coding specialist. Clinical coding is a constantly in-demand job. In Alberta, we are running out of new graduates, so we will always look for people. And regardless of the future of technology, it will always be a necessity. You can even go further into the data world and get into data quality or clinical documentation improvement like I have. You can be involved in the protection of health information management as an access and disclosure specialist. The role of an A&D specialist is not only to create interesting kind of practices and maintain those practices, but it also evolves to accommodate the needs of healthcare professionals and the patients as we get into more electronic health information. You could even be involved in decision-making processes for the delivery of healthcare and resource allocation. Business intelligence, healthcare sustainability, all of these are major fields that are really endlessly interesting because they balance health governance and delivery. So you can make an impact on somebody's life. Another way you can make an impact in patients' lives is by shaping the research. So data analytics or research might be a really interesting space so that you can apply the knowledge that you gained and make a difference in people's lives. Maybe communication is where you thrive. You're interested in creating standards or understanding the consistency of health data, or maybe you're looking to be involved in the governance of health information. You might be interested in working with organizational strategy or informational frameworks, all of which are really interesting and diverse career options. You might even be interested in educating the next generation of HIM professionals, and you're looking to become an instructor. There are no fancy degrees necessary, and we're focused on giving students real-life skills from industry professionals. You experience more than just the material from a textbook and become a valued member of the community from day one. Our diploma in health information management is delivered fully online, which means you can join classes live from anywhere, and you can interact directly with your instructors, but also every session is recorded, so you can review that material at your own pace and catch up whenever you miss a class. The online format gives you flexibility to balance your studies with work and family. We also include hands-on practicums, which allow you to complete lots of new skills and hands-on working in your own city. You can apply your kind of learning, all of your practical experiences you might have had before into a real-life setting. It also helps you make industry connections. It's a 2-year program, but you can do sort of like the classes as you sort of get into it. I guess I don't know all the specifics, so I don't want to speak too much on it, but it is a 2-year program. It does not require any coding knowledge at all. That's the beauty of a program like this. It is absolutely kind of basic, and then you'll get all the experience that you need and you'll learn as you go. I didn't have any coding experience prior to that. And then you get lots of job learning too, like hands-on learning when you get a job. Most of the time, we have slightly different practices around the provinces and depends on where you're at. So you'll get lots of hands-on learning as well once you've graduated after the program. That's a great question. There are opportunities to further your education in coding. You can do online programs for a specialization in coding, but that would all be after you're finished with your diploma. Nobody I know necessarily requires the coding experience. Lots of the time you can get straight into coding as a postgrad. I did. So there's no kind of additional educational requirements if you're wanting to get further into coding. So if you want to get into, say, making the decisions about what sort of things are coded or making decisions about that, you might have to further your education afterwards, but lots of that is self-directed and self-paced courses. The CHIM program, the CHIM, which is what the acronym at the end of your name would be, is this program. So you would have to take a test and then you would be a professional, you would be registered in a professional sense. But coding specifically is a separate credential if you want to further your education. You don't need to get into coding. I don't believe anybody has to have any health background. We give you all the basic medical knowledge. We have medical language classes and things like that. But if you're looking for the educational qualifications or requirements for admission, that will all be found on the website. The license to clear. So we do have a professional test that we have to do after our programs. It is called the National Accreditation Test or Exam, the NCE. That is done through our professional organization, which is CHIMA, or the Canadian Health Information Management Association, and their associated college. And that is one test. It's a little bit of an expensive test, but that will give you the credential on the end of your name, and it'll get you into all of the fun, interesting things that CHIMA does. CHIMA has professional communities, they have conferences. We really do like have lots of interesting things that you would get, and then you would maintain your professional like license, I guess, afterwards by just paying your yearly dues. It depends on what sort of field you're into, and what you're thinking of rate. Because if you're thinking of pay is pretty good for most provinces. We are we're highly sought after. It's a very in demand credential. Not a lot of people have it, and it is quite useful, I think. It's becoming more and more popular as a credential to have. You'll see sometimes on job applications, they'll require it. It is also still developing out, so lots of people don't know about this credential. So it is a bit of a sales pitch on your end from a new graduate perspective of if you're interested in a specific job or position to sell the sort of knowledge that you've gained in this program. Lots of times that's quite possible. I can think of lots of examples even here in Alberta. Um, Even as kind of simple as just going to a job interview and describing the program. Not lots of people know about it, not lots of people have done it. So the rate really depends on how keen people are. It is dependent on you selling yourself as a individual. And then in terms of sort of compensation and everything, that would be province dependent. And I do not know off the top of my head who would be the sort of highest end of that, and if that would differ between provinces. So where can we see job postings for this kind of credential? There are lots of opportunities to see job postings. As I said, there are some missing credential requirements, I think. Lots of jobs don't require it, but could really use a HIM professional. It's part of the reason why there is such a push for our professional organization to more sort of make those connections with industries to get our credential kind of recognized as an essential. But most of the time, you're going to have to look for the skills that you gain or the work that you like to do. Otherwise, if you're thinking about the specific credentials, lots of health authorities will ask for it, and it is called the Certified in Health Information Management credential. So if you're looking for it and it says required, that is the credential you would get and you would gain from this program. In terms of sort of looking for other job postings, you can look for the specific kind of skills that you want to apply. You can also look for jobs on the CHIMA website. So the CHIMA website, the Canadian Health Information Management Association website, once you're a student, you should be able to register for a student sort of access to the website, and then you have lots of opportunity within that organization to look for job postings. They have their own job board, they have community engagement that they do. It's part of what we pay for as HIM professionals, is that sort of kind of community engagement that CHIMA does for us. So there's lots of places you can find them, but kind of when you don't have the credential yet, mostly you're going to be looking for the skills. And then when you have the credential, you'll be sort of kind of asking for the jobs you want. It's a very interesting program in terms of like developing out your skills to then make industry connections and get into the healthcare field. If you're really interested in like healthcare data and data analytics, it's a great first stepping stone into that world. We have lots of data analysts who are HIM professionals within even my company and all the rest of the kind of healthcare companies. Medical coding, I love. I don't do as much of it anymore than I used to, but it's a great offer because you can balance your life. It's a type of job that you can often leave at work. There's always going to be charts to code, so when you're done, you're done. Even when they're really difficult charts, you're going to be leaving it and going home. And I think that it's a really cool program for that because you can do this online, learn how at whatever pace and however you best learn, and engage with HIM professionals. So lots of people have coding experience who would be your instructors. I would be a potential instructor and I have coding experience. I know other instructors have coding experience, and that is always a great sort of ask on what sort of fun or interesting things they could advise you on. So, on that note, I would like to thank everybody for attending today's session, allowing me some time to talk about the work that I do and the fantastic program that we have here at Ashton College. I hope you end up coming to be a student.